All right. So, hello everyone. Welcome to Mommy's Corner. I hope everyone is doing well today. My name is Saad Role. I am your facilitator, your host. We want to thank you everyone for being here today. This wonderful day in Seattle, Washington. Of course, it's never a wonderful day. Well, it's semi what
Alhamdulillah.
Alhamdulillah, we're here together. That's what matters the most. And we thank you for choosing to be here and to share this space with us. And we are blessed and grateful, appreciated your presence here today. I want to tell you a little bit about Mommy's Corner, especially now today we have a presenter who is new, who hasn't been at Mommy's Corner, and he's a male, mashallah, Brother Mukhtar. Welcome. Mommy's Corner is one of the many programs under the umbrella of Global Prenatal Services. Global Prenatal Services is a nonprofit organization. The mission to provide community-based doula services that educates, respect, and empower low-income refugee women and immigrants with their families during pregnancy, birth, into early parenting. Mommy's Corner is a space just for moms, but all women, folk, and since pandemic, all other women can come. You don't have to be, a mom, or you can be a dad too, or dad to be, or mom to be, are welcome. This is space. So Mommy's Corner started since the pandemic. It has become just a space where we can come together and to find the empathy, support, and I cannot pronounce this word. I have to get back to my sister Zainab. But it's a safe haven and it's access to so many critical resources in our community. Like today, our presenter, our topic today is COVID and information. And our presenter, our speaker today is Brother Mukhtar. Brother Mukhtar will be presenting the presentation and he will do his own introduction. We will have QA after the presentation, but if you should have any question concerning any other time during the presentation, please send via chat box or send it me privately. I will pass it along. A great thank you all guests for coming today. And our guest who is here today, Brother Mukhtar, and a community member who is going to be doing our presentation. And further ado, I would like to welcome Brother Mukhtar. You have the floor.
Thank you, Sauda. I really appreciate that introduction. First of all, everybody, welcome to this amazing event session. I really appreciate what the sisters are doing. It's a really great service to the community. I know our community needs this type of services, and I really appreciate what they are doing. It's really a brilliant idea, really important to the community. My name is Mukhtar. I'm from King County Public Health, Mukhtar Muhammad Sado, and I'm one of the East African community members, and I'm from Oromo community. My background is a little bit medical, business, linguistic, and I get everything from all the field is a little bit here and there. So I have a really good background on healthcare system, and also doing this presentation for almost a year now. So since I'm going to do the presentation for moms, I'm going to start with COVID-19 and pregnancy. Would that be something?
Oh yeah, definitely.
Okay.
That's what we hear. COVID-19.
Okay, so who is going to translate for me? Are you going to help me with that?
Wait, I thought you speak Somali. Are you kidding me? Woo. What?
Oh man, this is your job now. I speak Oromo, Amharic, and some Swahili. I'm not good at Somali. No.
Somali? Okay, so
Yeah.
okay then. No, yeah, sure. I'll translate for you. Okay,
Thank
definitely.
you.
No problem.
Thank you.
I like that. He's like, oh, I thought you spoke Somali.
No,
Okay,
no, I don't speak Somali. I wish.
no problem. We're all Oromo and Somali are very close anyway. So
Yeah.
we got
Yep.
you.
Part of Somali's part is Oromo. Oromo part of Somalis
Oh,
is,
yeah,
yeah,
definitely.
we are very close. We are Cushitic people. So so COVID-19 and pregnancy.
Mhm.
So that is a topic. Why we need to talk about, COVID and pregnancy.
Mhm.
As you guys know, COVID is very contagious virus that can, affect all of us, including pregnant women
Mhm.
and babies. So we need to have some knowledge about it. So when mom has, a baby, um, that means pregnancy can change the body, that would make it easier to get very sick from respiratory viruses like the one we have in COVID. And these changes can continue after pregnancy. So I want you to translate: pregnancy can cause changes in the body that make it easier to get very sick from respiratory viruses.
Mhm.
That part, go ahead.
And qof ma ku jira horta kow oo rabo in loo translate gareeyo af Ingiriisiga hadduu ku jiro please hadeertaan ii sheeg haddii kaleete
Yeah.
yes haddii kaleete we're gonna just continue in English gabdho. Hello. Okay.
So as you
Oh,
mentioned, okay.
so you're good. That means
As you mentioned earlier, if they have any question, they can stop me anywhere.
yes.
Even if
So
we
you
can
you don't have to translate. Everybody understands English, so you're good to go.
okay, thank you.
Yeah.
So here are a few things you should know about, COVID and the pregnancy.
Mhm.
The first one is that pregnant people pregnant people right now, or pregnant people in the future, are at high risk to get COVID-19 compared to non-pregnant people. Some, underlying medical conditions can also put you at high risk. And pregnancy can also put you under high risk even after, 42 or some days after the pregnancy, you still can get it. You still at high risk. You guys can stop me if if you guys don't understand me, or
Keep going, yeah.
get the thing I'm saying. Stop me and I will clarify.
Okay.
Okay.
Yes, definitely.
So when we compare people who are not pregnant with COVID and have symptoms, people are, pregnant with COVID. I mean, with COVID, pregnant have symptoms, a lot of symptoms that you can, tell. The more, it is like more times likely to get in hospitalization if you are pregnant and get COVID. You are more likely to get in ICU, get hospitalization, also get ventilator, and get life support. So there is a 70% chance of getting, very ill, and at the end, death can occur as well. So it is very important to get vaccines and doses as well.
Mhm.
So it is especially important for pregnant and recently pregnant people and those who live with or visit them at the hospital or at their house, anywhere, to protect themselves from getting sick with COVID-19. It is important to get these vaccines. And I hear a lot of rumors about the vaccines, and some people say it is haram and some people say it is not. But to say it is haram, people should know the ingredients.
Are you using slides? If you are, can you email it to me so I can share it with you?
Oh, I can't. I'm using my phone, so I can't. But I can go slowly if I'm too fast for you.
Oh no, it's not about fast. No, you're not. You're not going too fast. I was wondering just if I can just share it, like with.
Which one? What slides do you have on your computer?
No, I don't have any slide. Like the slides. Are you?
In Somali, in Somali.
I don't have any slides.
Oh, what is the one you shared earlier?
Oh, it was just the informational.
Okay.
Yeah.
Let me see if I can send you.
Yeah, if you can email me, I can just put it on for you, and then you can just
go from there.
Yeah, that'd be great. Yeah, because people say they can't see the slides. They can hear the clicking. I know you have the slides, but they can.
No, I don't have. I mean, the clicking is for my computer. It's not. Hold on, just let me see.
Okay.
So let me see if I can send it to you. The slide we used before.
Okay.
So what is your email?
Saad, SUAD dot
SUAD?
dot Farole, FAROLE.
Okay.
At Comcast.net.
Okay, did you get it?
I think so. Hold on. You can continue to talk while I'm checking it out.
So pregnancy is one of the underlying medical conditions that CDC put under one of the medical conditions. So it's very important for people to get for pregnant people to get vaccinated. And some research show that the benefit of getting COVID vaccine is outweighs the known risks of COVID-19 vaccine. So it is important for sisters, for women to get these vaccines. So if you have COVID-19 and are breast or chest feeding, it is not likely that COVID-19 can pass through breast milk, or it doesn't cause any problems. So it is important whether you're feeding, breastfeeding, or whether you are pregnant, get this vaccine. So most information show that it is safe to feed breast, while if you have even COVID-19, if you have it, you can feed your baby. It doesn't pass, you can't pass to your baby while you are breastfeeding, but you need to be careful how to take care of the baby. You need to cover, your face with mask. You need to clean your hands before touching the bottle, the pump, and stuff. It is okay to feed while you have COVID-19. It's okay. So breast milk is the best source of nutrition for most babies. And it also helps protect babies from infection, including different infections like ear infection, lung infection, and digestive system infections. So I really emphasize that even if you have COVID-19, you need to still keep feeding your baby. The other one is, when you get vaccine, that vaccine can pass to your baby and it will give protection to the baby as well. So if you have any questions that you don't understand, you don't get it, you need to ask your, doctor, talk to your doctor, your healthcare provider to see if you can get the vaccine as soon as possible, if you have doubt or anything like that. So I'm gonna go back to the ingredients of the vaccine. The vaccines are, especially the messenger RNA, they are made of protein. I don't know if you guys see, it has spike. It is called spike protein. That spike, they made the same spike protein and put in the vaccine. So there is nothing haram that will make it haram for us to take the vaccine, because it is not, there is nothing there is no milk in it. I mean, no eggs, no pork and pork products in it. So it is halal for us to take the vaccine to protect ourselves, our family, and our community. The other one, this vaccine, these protein vaccines are for Pfizer and Moderna. The Johnson and Johnson, they made from very weak cold virus, similar to cold virus, adenovirus. So they don't even cause harm to human being. Let me go back to Moderna and Pfizer. They made of protein, and they cannot give you COVID-19. And also they cannot make you unable to become pregnant or to make people pregnant. It doesn't decrease the sperm, the count of the sperm. So it doesn't have any side effects that much. The only side effect once happened was a little bit myocarditis or pericarditis related to heart, inflammation of the outer part of the heart and the inner part of the heart. In few cases in King County, but that is not the case anymore. It's not happening now. And also from the COVID, the Johnson and Johnson, we had rare cases where people get a blood clot and other immune system like weakness of muscles. So in that case, CDC and Public Health, King County, and the State of Washington Department of Health, they are recommending Johnson and Johnson. I mean, recommending Pfizer and Moderna more than Johnson and Johnson. Johnson and Johnson is still safe vaccine. You can get it. You can get the booster as well, but it is not effective as COVID, Pfizer, and Moderna. Any questions so far? Is it clear, or do I need to repeat myself?
Oh no, you are very clear. So here is your slides. What slides are you at right now?
I'm everywhere. I'm talking about pregnancy. I'm talking about, I'm not using just one slide.
Oh, you're everywhere. Okay, sure.
Yeah.
All right, no worries.
Okay.
So
I mean, I can go ahead and talk about this. Scroll down a little bit.
Oh, sorry. Pass. Oh, this one right here?
Yeah, I talked about this. Continue.
About that, how about that one?
I talked about this as well.
Okay, that one.
Yeah, I talked about this as well.
This one.
So here, if you haven't,
talk with your healthcare.
Yeah, I talked about this as well. Yeah, go to that. So we talked about, COVID cannot pass through milk, breast milk, and your baby will not have COVID from breastfeeding. Will not get it. And it is also important that breastfeeding can help the baby to have, that protection as well through through the breast milk, because once you get it, you give that protection to your baby. So it is really important. Any questions so far?
سؤال يا قبل anybody any questions so far? When vaccinated, antibiotics are shared through the pregnancy and breast chest feeding. This means that not only it vaccinated protects the person who is pregnant, it's also protecting the pregnancy and the baby against the COVID. Wow.
Yeah. So it is important for us to get vaccinated to protect ourselves and our family as well as our community. We will stop, the spread of the COVID by, getting vaccinated.
So how do you explain our community who's still against? I mean, I work with a lot of moms.
Very good question. Go ahead.
Who are pregnant and they're still refusing to get the vaccine.
So the issue is that we are not getting in the right accurate information. We're getting information from social media, from different people. So we shouldn't get information first off. We shouldn't get information from online. We should get information from your care provider, CDC, and public health. And so once you get the information, there is you can't say no to it, but you need to compare the benefits of the vaccine and also the the risk. And I know from my community as well, from Oromo community, people they don't trust all this information. They don't trust the government because that's what we have experienced in our life. So everything people tell the government or anybody tells us, we take it as no, this is not right. So in this case, in COVID vaccine, these vaccines are harmless. They don't cause very bad reaction, and they are very beneficial. So even if you claim it is really because of my religion, there is nothing that says there is nothing that is wrong, that's haram in the vaccine. So we need to educate our people so that they need to learn the ingredient. They need to know all the ingredients. Then after we teach them, show them this is the ingredients, they should take it. So I would say it is important to take this vaccine, and also get the right information from the right people, like you doctor, a CDC, like Mom Corner. you need to get it from there.
Yeah,
and there is no risk, but CDC recommends taking Pfizer and Moderna more than Johnson & Johnson because of some safety issues there.
I see.
Any other question?
And of course,
So if they have any question, they can call the call center. I don't know if you can you scroll down a little bit?
I can actually, no, I have the information for
you have the information. Yeah, give it.
Share it. I think it's right.
So we have.
I have a question, and I posted in the chat too. But I have a question, Brother Mukhtar. Yeah, with I think it's in a week or so we might actually they might remove the mandate. The mandate.
21st indoor.
Yeah.
Yes.
What does that mean? How can people continue to protect themselves? Because obviously this virus is not just going to be finished just because the mandate is over.
So if you see other states, they are not implementing this.
Only 5 states.
Yeah, only few states. So even if they lift it, it is up to us to use whatever method that can protect us. We still keep doing what we have been doing since the outbreak. So the government is not mandating it. It is not mandatory anymore. they will lift it. Then what will happen is the organizations, different organizations like Mom Corner, like the program right now, what we are doing right now can implement their own guidelines. They can say people will not come to our program unless they wear a mask. They can say that, but the government will not enforce it. So to protect ourselves, we need to continue what we've been doing since the outbreak. That is the answer. I mean, this disease is not going anywhere. It's going to be here with us, so we need to be careful about it.
Long time.
Yeah, we don't know when this will end. So I don't know if I answered that question, but if I haven't answered it, then I'll pass to my supervisor and he will explain more.
Did you get your question answered, Faiza?
Faiza?
Oh yes, yes, you did, brother. Thank you. And the other one I had was, do you know if this is going to be like the flu? Like getting the shots every fall.
Yeah, I'm gonna talk a little bit about that in a few minutes. We are given boosters now, a booster for Moderna and for 3 vaccines. Up to now, what we know is we only need this booster, just booster. We don't know if we will need next year. We don't know if we will need every year as flu vaccine. So we don't know. There are about 28 or 30 different flu viruses out there. So they give you different vaccines every year. I don't know if this will be the same with the flu vaccine. So I'm hoping this is the last vaccine we will get for COVID-19, but we don't know. The information I'm giving you is up to right this moment. After we've done this presentation, if we go to CDC or Washington State Department of Washington Health Department, Health, they will have different information. So we don't know. We are still learning a lot. So that is a good question, and I hope I answered your question. We don't know yet, but we will learn. We are still learning. Okay, anything else? Anybody else? Any question?
Oh, so far so good. Continue. I just shared the community bi-weekly partner calls, and I think we're going to actually partner up with this. Actually, we are going to partner up with this. Everyone is there from 3 to 5:30.
Okay.
Definitely, yeah.
Okay, Faiza, thank you very much. That is a really good question. So how about booster? Did you guys know what booster is? And anybody has taken booster yet?
Yeah, I took a booster. I mean,
but you got it?
Of course, yeah. I work in health.
Yeah, so what happens is that when we take our first shot, it teaches your body how to protect to teach your body about the new virus, about the virus. And then the second one, it will maximize the protection. Now what happens is over time, our immune system that defends our body from viruses, bacteria, anything that invade our body, it will go down. The protection fades away. So the booster will increase that protection, will maximize. So for some people, people with immunocompromised, they have to get 3 shots to get the same protection equal to healthy people who get 2 shots. So they have to get 3 shots. The immunocompromised people with different diseases, with like diabetes, high blood pressure, taking chemotherapy, taking treatment for different types of diseases. So those people need to get a 3rd dose as part of their initial vaccine. So instead of getting 2 vaccines, they will get 3. And on top of that, they will get booster. Is it clear?
Wait, repeat that again. No, I got my booster, so I'm good to go, right? I don't
You
have.
are good to go.
Oh, okay, you scared me out there because I thought I was going to get another booster.
Because you are not, you don't have underlying medical conditions. What I was talking about was about people who have underlying medical conditions, such as diabetes, high blood pressure, taking chemotherapy, cancers, all those people need to take 3rd dose. And for them, the booster is going to be the 4th dose. So you are good. You're good.
For people who are underlying condition like diabetes,
Yes.
who take like insulin or
Right.
monitor their blood sugar and all that stuff, or take like a medicine,
Right.
have to take booster like, oh wow.
No, but not booster. The 3rd dose, they take 3 doses. And instead of 2, they take 3 doses. And they get also their booster later.
Okay.
So they get 4 actually.
Whoa.
Yeah, 4 shots.
Wow.
Okay.
Wow. Okay. I guess so.
What else should I?
Does someone need a booster if they got COVID?
You can take if you get COVID-19 before getting your shot, after getting better from COVID-19, you get either your initial vaccine or your booster. If you get your initial vaccines before, 2 vaccines, then you get your booster after you feel a little bit better. But you don't take while you are sick, while you are having symptoms. Any other question? We got 15 more minutes.
Yep. Speak now.
Faiza, do you have any more questions? Also,
gabdhayaa su'aalo qaba oo ku saabsan uurka, boosterka, iyo maxaa la dhahaa iyo vaccine-ka. Dad badanaa waxaa maqlay Soomaali oo dhahayo haddaa geedkan qaadato ilmaha waa kugu xirmayaan waxaas. Is it true that they say if you get vaccinated that you can't have no more kids, you're going to be steroid?
No, that's not true. That's false. And I said earlier, if you take the vaccines, it will not make you infertile. It will not make you it's not gonna make it hard for you to have baby. It will not. So it will not reduce your sperm. And it is very safe. It's not, it doesn't go to the the DNA. Okay, so you will have babies, no worries.
Yeah, because
it will help you baby as well. Getting vaccinated, getting the shots will help you baby.
Can a mama get vaccinated after delivering baby? How soon can she get vaccinated?
There is no specific time and date on that, and she can get right away if she wants.
Okay.
She can get it, but she has to feel a little bit better.
Okay.
Okay. Anything else? I need to clarify, or do you want me to talk on something else?
Yeah, go ahead. Go for it.
Okay, what else should I talk about?
Kids.
Yeah, kids, up to now, we have vaccines for age 5 to 17, which is Pfizer. Okay. So we don't have vaccines for children under 5. The study is still going on and they are working on it. They're supposed to get permission from FDA this week, but they postponed it. So I don't know where they will meet again and talk about it and see if there is any risk or if they will approve it or not approve it. So up to now, we don't have vaccines for children from, under age 5, but from age 5 to 11, they will take the same vaccines that we've been taking, but they will take 1/3 of that vaccine. Okay, they don't take the whole thing. We give it to them 1/3 of the vaccine. And people from 12 to 11 to 17, they can take Pfizer as well, and they also can take their booster. But for children below 11, they will not take their booster. For Moderna and Johnson, they can take people age 18 and above, they can take Johnson and Johnson as well as Moderna and Pfizer. Okay.
I like that. Do kids require to have a booster for the teenagers?
Teenagers, nobody is required. I mean, government will not enforce you to have, boosters, but we really encourage them. We very encourage them to take it booster. So they are not required to take it. But we don't know in the future what will happen if the school will require the booster shot or not. We don't know up to now. Anything else? Is it clear? Did you guys get a
hint of things? Yes.
Hint of what I was trying to say.
Hay Gabriel, su'al ka ba o kale?
Does someone need a booster if they got COVID? Yeah, they need a booster. Still, they need a booster. When you get COVID-19, after the COVID-19 is over, you will have natural immunity. Natural immunity means our body produces this protection by nature, and that will protect us for some time, but it doesn't last. It will not last for long. So what we can do is we already got our 2 shots, and it's important to keep that protection to get the third, the booster shot. So yes, somebody who got COVID-19 can get his or her booster.
I see. Yeah, it makes sense. Interesting.
Yeah. Thank you. Anything else?
So anybody has any questions? Speak now or forever hold your peace.
Jamila, Amino, Sharif, Amal, Fahamo, Ali. Oh, mashallah. Thank you for joining us. Thank you for joining this session. It's really helpful.
I will use this, guys. Hold on a second. There you go, guys. All right. Anybody have any question?
If you have, Sauda, if you think there is something I can answer.
Oh no, I don't have any questions. I mean, you did an amazing presentation, brother. We thank you very much.
No worries. Thank you very much.
Coming out and doing this amazing presentation.
Amalia,
Amalia, you have a question?
Not really. I'm just listening.
Thank you, Amalia. Thank you.
Thank you very much. Well, thank you.
So there is no reason for us not to take COVID-19 vaccines. It is not haram.
There's no haram.
It's not haram.
It doesn't have a pork.
No pork, no gelatin, nothing.
Gelatin, nothing.
Yes.
Yes, it's not going to keep you away from having children.
Yes.
You can produce.
How does it look as far as data goes, brother? What does it look, the status of just number wise of us, for folks from Africa?
Oh.
Do you guys have that data?
Yeah, they didn't break it down into regions and continents, but what they have is they have the overall data, and not this week, the week before, the hospitalization rate was very high. Still, it is high. It is at 75% capacity of hospitals in King County, but it is declining because it went up to 92% a few weeks ago. Now it's going down a little bit since the Omicron, variant breakout. it's getting better now. But we need to be careful about it. We need to keep ourselves safe and our community safe by getting the vaccine and doing what we've been doing
Washing
so
your
far. Yeah,
hands,
washing hands,
wearing your mask.
wearing masks, and keeping distancing and stuff. So the thing is, what I went to Africa a few weeks ago.
Oh,
Um,
came back from the motherland.
yeah, I came from motherland. You know, it is funny back there. They were saying there is no COVID and they don't believe in it. And people are not sick. If they are sick, they get mild illness.
Yes.
They're not very sick. I don't know what happened. I think it is similar with Kenya and I mean
Yeah.
with East African community. I mean countries in Somalia, Kenya. I didn't hear much about Kenya, but Ethiopia, it's not that bad. They don't have so many numbers, so many patients. People are, they don't even wear masks. They don't care. They cough and they tell you it is fake. What you guys are talking about is fake. It's not real. I mean, it doesn't, they say it doesn't come to us. But in reality, here we've seen about, we've seen a lot of deaths and more than 800,000 people died in America. So it is serious.
Because they don't believe, that's why.
Yeah, they don't believe. I
Yeah.
don't know if they believe or not. They don't.
Yeah,
Care.
but I was having one question.
Uh-huh.
When I was trying to buy my car to sell it, and one person, she was telling me she was having some disease for breast. So the doctor mentioned that you can't get a nut shot. So their job, they said that you have to require to have the COVID vaccine, So she doesn't have no job right now. And I don't know what kind of disease was that, but she said for breast, some disease. That's what she told me.
Oh, okay. So here, one thing I want to make it clear: she can't get vaccines. Vaccines are free, but to get vaccines, if you have, as I said, underlying medical conditions like what you are saying right now, she needs to talk to her doctor and she needs to follow her doctor advice.
Yes.
So to figure that out, she has to talk to her doctor.
Yeah, the doctor, they advise her, you can't get not shot. If you get shot, you'll pass away,
Yeah,
that's what
okay, yeah. She needs to follow that. She needs to follow through.
Wow.
Yeah. And also she can talk to the people. If she decided to get it, when she go to the pharmacy, she can talk to the pharmacist. We have Somali brothers who has who have
Brother
pharmacy.
Ahmed.
I don't know his name.
Othello, Brother Ahmed.
Othello, Othello, yeah.
Yeah.
We can talk to him, yeah.
Wow. Unbelievable. Yeah, at the end of the day, yeah, whatever is going on, you have to get the advice from your doctor.
Your doctor, and also your your pharmacist. They know. Even I believe sometimes they know more than the doctor knows.
Yes, trust me. Doctor, pharmacist will spend with you a lot of time. Doctor would not.
Yeah.
Wow.
Yeah, and the other thing is that dude, he is from our community and he speaks our language.
Our language,
yeah. So that's very helpful. Okay, anything else?
Last question, ladies, before I let you guys go. It's Maghrib, I know. It's almost 6 o'clock. Anybody has one last question burning?
Or any comment?
Or any comment, any concerns?
How can we improve this training? How can we have more training like this?
Yes, how can we improve the training? How can we have more training? We want Brother Mukhtar to come back, inshallah, another time.
Thank you.
You guys want him to talk about it next time? Anything, ladies?
Yes, we need for the booster, what it will affect for pregnant women. Next time, maybe.
Okay.
Inshallah.
Inshallah.
booster and pregnancy. Inshallah, I'll contact you, Brother Umar. I mean, Brother Mukhtar, inshallah.
Okay.
To see what your schedules look like.
Okay.
All right. Jazakallah khair for coming
Okay.
out, and
No worries.
I appreciate you. And,
Uh,
you know, you're taking this time to show up and, you know, to give the community, you know, serving our community, you know, so Jazakallah khair, we appreciate it. And thank you everybody for coming out, you know, to spending your time with us. Inshallah, we'll see you guys in next Saturday, same time at 5 o'clock.
Okay. Thank you very much. Assalamu alaikum.
Wa alaikum salam.